Hello YouTube. So it has been about 10 weeks since my last pregnancy update. I'm pretty sure it was my 25th week, or I was 25 weeks. So I am now almost 35 weeks. I'm 34 weeks and 4 days today. And pregnancy's been good. It's a lot harder being pregnant when you have a child to take care of than it is being pregnant without a toddler that you're chasing after. But I can't complain too much, although I will complain and tell you everything that I'm feeling. So since my 25th week, probably the biggest change that has happened is I have problems with my SI joint and my pubic bone, and they kind of go hand in hand. The SI joint it's really not a joint, like it shouldn't be a joint, but like you have your hips or your pelvis, and it's the joint that's like at the bottom of your spine, I believe. You'd have to look it up, but it's really not supposed to be a joint. But then when you are pregnant and you have that relaxin hormone going throughout your body and everything's kind of moving and adjusting, mine oftentimes kind of goes out and goes out of place. So I either will have a hard time walking on one leg or the other, and I'll have a lot of pain in my lower back. But then if I move just right, it'll pop back in, or whatever. So that happened first. And I tried seeing a chiropractor. My doctor said I could go to a physical therapy, so that, I could kind of learn how to pop it in and out. But I kind of already am doing that, when it does go out, so I didn't really feel the need. And it basically is just like, yep, that's just what's happening while you're pregnant. Like, you just have to deal with it, which is fine, as long as, the baby's okay and everything's, as long as it's normal for my pregnancy, I'm okay with dealing with it. It just kind of sucks because it does oftentimes hurt. Oh, the sun is coming out of the window. And then a few weeks after my SI joint problem, I started having problems with my pubic bone going in and out. And that is just basically a reaction from my pelvis moving and being kind of relaxed, and things are becoming joints that really shouldn't be. And so I noticed that probably about a month ago, I got up and I had a lot of pain in my lower pelvis. Like, it just felt like that, felt like my pelvis bone or pelvic bone, and it hurt to lift up my leg, to put pants on or a shoe or anything. It just felt like it needed to pop. That's the best way I could describe it. It felt like my pubic bone needed to pop back into place. And it was hard to walk. I didn't have full range of motion of my right leg, and it was just painful. Luckily, I had a doctor's appointment that day, and I talked to her about it, and that's just part of what I'm going through with my SI joint and everything. It's all popping in and out. And it's just normal right now for me while I'm pregnant, and everything should go back to normal after I deliver. But that's just something I'm dealing with currently. I unfortunately got super sick. It was December 19th was the day I got super sick with some kind of stomach bug, some kind of stomach flu. I couldn't keep anything down. I was just so nauseous. I was just throwing up everything, even water. And I was nervous I was going to be dehydrated. And I think that the dehydration combined with throwing up really stepped up my Braxton Hicks contractions. I've had Braxton Hicks contractions with this pregnancy since 16, 17 weeks. I've started feeling them, But of course, that's normal. They were never consistent. They would just happen a few times and they would go away. I had a doctor's appointment that day that I was sick, and I went in and told her what was going on, and she told me the things to look out for if my contractions got worse and more consistent, and if I'm feeling dehydrated, I just need to go in to labor and delivery, and they'll give me some IV bags and get me all situated. But and that was basically it. Like, go home, try to get some fluids in you, and call it a day. I actually felt really good, or a lot better that night. I was able to keep some Powerade down and go to sleep, and I was, not feeling as nauseous. I was feeling a lot better. And then I woke up about an hour and a half later and was so sick. So sick, so nauseous. I was just freaking miserable. And then I remember waking my husband up and telling him how awful I felt. And then I was like, I think I'm having contractions, real contractions, because my stomach and everything, I couldn't tell. My stomach just hurt so bad from being sick that I couldn't tell if I was having contractions or if I was just being sick at first, and I was still half asleep and whatever. And then I just sat in bed for a minute and I tried to let the nausea pass, and then sure enough, I was having contractions, and they were about 5 minutes apart, 4 minutes apart. And then I was like, okay, we need to go in and get this checked out. So my mom came and stayed at our house with my daughter, and we went to labor and delivery. They got me all hooked up. We're monitoring my contractions and the baby's heartbeat. And sure enough, I was having contractions every couple minutes, but they were not progressive. They did check me, and I was not dilated, and I was not, my cervix wasn't thinned at all, so that was really good. But we didn't want it to turn into progressive contractions from dehydration or anything else. So I had 2 bags of IV. They checked my urine and did some blood as well, just to make sure everything was okay. And urine came back fine. I don't know exactly what they were checking, but they checked it and it came back fine. And since I wasn't dilated and everything like that, my contractions were slowing down from every 2 minutes down, and then they slowed down to 5 to 7 minutes after my IV fluids. And then unfortunately they did pick up again and start to get more painful. And they were, when I say they were painful, and they were just really tight. They were just I couldn't talk through them. On the way to the hospital, I just couldn't even talk through a contraction. They were just so uncomfortable. Anyway, so they ended up giving me the, I'm going to say this wrong, Trabutaline, I want to say, shot. It's a shot they put, they just do in the back of your arm to help stop the contractions. It hurt like hell. It stung so bad. It was a tiny little needle. The shot, the poke itself, you couldn't even feel. But the medicine going in hurt so bad. And then I felt like I was having a heart attack, because the side effect of the shot is it makes your heart pump out of your chest. You get really hot and just feel out of breath, and it was just, you're super uncomfortable after the shot. But I was grateful for it, because I probably had a contraction right after she gave me a shot, and then I didn't have another one after that. So I was, after about 45 minutes or so after the shot, we were able to be sent home, and I haven't had any issues since. I have had a lot of contractions, Braxton Hicks contractions and whatnot, that are uncomfortable and sometimes consistent, but my doctor said as long as I don't have 10 in an hour, then I'm okay. So Christmas Eve, I did have, there was a couple hours that I had 6 in an hour, then 8 in an hour, and then back down to 6, and then 4, and then they kind of trickled down. And then again the next day, kind of the same situation, and I just kept track of them. And then if I ever start feeling them pretty intense or more consistent, I just track them. And so far I haven't had 10 in an hour. and we seem to be okay. I do have my 36-week appointment on the 16th, and she'll check me and see if I'm dilated or starting to progress. And at that point, I'll kind of relax, because I just don't want him to come too early and, you know, be in the NICU or have any issues. Fortunately, our little labor and delivery stay was only for a few hours, and, you know, everything seems to have stopped since then. So at this point, we're just getting ready and prepared as possible for him to come. If I do not go on my own, into labor on my own, before the 7th of February, I will be induced on February 7th. We just, you won't be able to see it, maybe, set up our car seat. We had to buy a new car seat this time around, even though our old one isn't expired, that we used with my daughter, because that one was in a car accident. It was just a little, like, rear, you know, fender bender. We were rear-ended, but we don't want to take any chances, so we bought a new car seat and got it all set up today. And we have our bassinet in our room ready to go, and a rocking chair in our room. Emery was in our room for about 6 months before she slept in her, like, started sleeping in her bed. She'd always start off in her bed and then end up in our bed because she never made it through the night. Emery didn't sleep through the night until she was, like, close to 11 months old. So we don't have his crib or anything set up. We do have a crib for him, but we don't have it set up. We're planning on just putting him in the same room as Emery, but I don't see the point in kind of rocking her whole world and her whole situation right now, when he probably won't even be in there for at least 4 months, probably closer to 6, if it's anything like Emery sleeping in our room. And I'm totally fine with him sleeping in our room for as long as we want him to. Especially if breastfeeding goes a lot better this time around. Breastfeeding with Emery was so difficult. We just had so many issues. I had supply issues. We had lip and tongue tie issues. Like, just from the get-go, it was awful. This time around, I'm hoping it will be better. I've already talked to the pediatric dentist who lasered Emery's lip and tongue tie, and told him I need him that day. Like, if baby boy is born and we know he has a lip and tongue tie, like, we need it corrected. And he's like, you know what, you can come the day, like, you're sent home from the hospital. You can just drop by, we'll get it done, and you'll be good to go. I'm also having a lactation consultant come to the hospital. We have different insurance now. It's like amazing insurance, and they pay for breastfeeding support. And so, I mean, even if they didn't, we would be doing this. It just is a bonus that it's covered by insurance. So we'll have someone come to the hospital and make sure that the latch and everything looks good, and check his mouth. Because I felt like no one at the hospital, as much as they tried to help us, I was, like, in so much pain. We never got the latch right. And it wasn't until we got home and had a lactation consultant come to our house that we found out all these issues. So I'm hoping that we can nip all this in the bud with this baby in the hospital, so that we can have a better breastfeeding experience. And also, I'm praying that my supply will be so much better than it was with Emery. I was unprepared. I didn't know what to do. I tried my best, but I did end up breastfeeding her. It was just a huge struggle, and we never 100% breastfed. We did have to formula feed, and supplement when I couldn't make enough or whatever. But I'm grateful for what I got with her. I'm just hoping that this time around is a lot easier. I also, this pregnancy, which I never experienced with my first pregnancy, is I am leaking colostrum, starting at like 32 weeks probably is when I started leaking colostrum. It's not a ton, like I don't need to wear pads or anything like that, but if I, the reason I noticed that I actually leaked was my daughter. I was laying on the floor with my daughter, and she had used my boob to like push herself up, and that was enough to like make me leak. And then I've noticed anytime, like if I squish my boob, for sure colostrum will come out. But if, you know, they get squished or whatever, like, it does come out. So it doesn't really mean anything. From everything I've read, there's plenty of women who have a perfectly like great supply and they never leaked before having, you know, before delivering. And then there's plenty of women who had freaking leaky boobs and then they delivered and they had a horrible time keeping a supply. So I'm not getting my hopes up with that. I'm just praying that it is a good sign, though, that this time will be a little bit different as far as our supply goes. Anything else that has happened? I don't think anything else has really happened. It's been pretty boring. I still get migraines every once in a while, but they are totally manageable. I take my butabitol and put a lot of peppermint oil on my neck and head, and I'm usually good to go. Other than that, my whole body feels like it's 100 years old. But I feel like that is just, it just comes with the third trimester. I'm grateful that we're in the home stretch, and I'm a little freaked out that we're now down to like the last month of like just the three of us before we add another baby to the family. But I know once he's here, it'll be okay, and it'll feel like this is how it's supposed to be. So I'm gonna do a belly shot real quick. Let's see if I can do one. I'm wearing purple pants. Whoa, it's like super bright. Here we go. So this is my 34-week belly. Seems pretty massive, but I was looking at pictures of me pregnant with Emery at this time, and I actually feel like I was a little bit bigger with her, so I don't know. He definitely feels like he's up in my rib cage and like squishing all of my organs, so I think he's just sitting farther back. But either way, we're both healthy, and we will have a baby here by February 7th regardless, so it's kind of crazy. All right, hope you're all doing well, and if you have any questions, let me know.